morning, everyone. Happy Saturday. It is 9 a.m. Central, where I'm at. It's in Des Moines, Iowa. That is where I am doing my live from. Where are you guys listening from? Good morning, Lion. Happy Saturday, you guys. Welcome. I am Dr. Malea Jensen. I am a family practice physician. Again, I am located in Des Moines, Iowa. Good morning. So where are you guys listening from? Welcome. We'll let everybody kind of join in. This is your opportunity to ask questions. I might not know the answer. I will let you know if I don't know the answer, but I think, have a lot to talk about this morning. I think there's been questions. I've gotten a lot of questions this week, whether it be on threads or on Twitter or just personal emails and texts. I think that you guys are, starting to wonder, like, who's right, who's wrong. There's so many things that are going on that you find it hard to even sort out. So if you are on YouTube right now, please like, share, subscribe. I am live also on Instagram, so share this with somebody if you figure that they might need it. They might need a little education this morning. Thought we would talk a little bit about plants and anti-nutrients and the difference between plants and animal foods. I think you guys get the drift. Iron Factory Weightlifting. I like that name. Where is Iron Factory Weightlifting? Let us know. That's a great name. The IronLadyDoc would love to lift at Iron Factory Weightlifting. That's awesome. Maybe it's not a place. Maybe it's just a business, but awesome. Good morning, Todd. So plants have anti-nutrients, and those can be detrimental. Now, there are ways to prepare plants that can help lessen the amount of anti-nutrients. Those anti-nutrients are oxalates, phytates, saponins, tannins. They also have protease inhibitors. Oh boy, what is that? Well, we'll get to it. Lectins, they have fiber. Plants have fiber. Plants, however, have little or no things. I'll just mention these. They have no B12. There's no carnitine, carnosine, creatine, DHA, EPA. There's no saturated fat. There's minimal, if any, choline. So a plant-based dieter, plant-based consumer would have to consume all of the things I just mentioned: B12, carnitine, carnosine, creatine, DHA, EPA, saturated fat and cholesterol. Good luck with that one. Although, let me tell you a secret. And choline. Plants also have goitrogens. So plants have anti-nutrients. How can we get around the anti-nutrients? How can we get around oxalates, phytates, saponins, tannins, all of those things, lectins, fiber? How can we get around some of them? We can get around them by our cooking procedures. So if a plant-based person, or just you want to consume a ketogenic diet, which is moderate amounts of protein, high in fat, or how about this? It's lower in carbs. And the carbs you choose are plants. To get around those oxalates, phytates, saponins, you would need to cook it in such a way. And if you're not eating animal-based products, you want to supplement with B12 and carnitine and creatine and carnosine and choline and DHA and EPA, or don't. Those are the Those are the truths. And I think if somebody is eating a plant-based diet, they know these things and they are supplementing. If you're not, tell me why and how are you doing? So I am live on Instagram and YouTube if you guys have questions. So if you have a question, just put a Q in front of it. Good. So Sashin says, yes, I know this and I'm good. So that is important. So I think when somebody just jumps into doing a certain diet and they don't know these things, so Sashin knows these things and they're good. So that is very important. And I'm hoping that if somebody that Sashin knows, he or she is going to share that information with somebody else who's also thinking about eating a plant-based diet. Makes sense? So that's got to be word of mouth. So if Sashin knows that what he or she is consuming does not have B12 and notices that one of his coworkers or his or her friends, family members went plant-based and are not eating B12, they're going to say something. Make sense? Elf says, I suffer from inflammation. Okay, inflammation. Okay, tell me more, Elf. Lucy says, beautiful morning, Dr. J. Life is good. Love hearing your voice and wisdom. Happy birthday to me. It's your birthday. Happy birthday, Lucy. Welcome, and thanks for joining me on your birthday. Are you having a cup of coffee? It is early there, earlier, an hour earlier. So hopefully you are enjoying your morning. Gonna go for a walk. Midnight Sun has joined us. So do you guys have questions in regards to plants and plant-based? I get that question a lot. In fact, Carla, I'm glad that you have joined us because Carla had a question. I posted a picture of me. It was a post, I believe it was on Instagram, of my previous in my bodybuilding years, and I said the point I made was keto was a very powerful key to getting me on stage and getting me in shape. And the question was, you did keto and not carnivore? So I think I need to maybe describe a little bit about the differences between the ketogenic diets. A ketogenic diet is kind of a broad term used to describe a low carb diet. So a person can be keto, meaning they're eating about 20 grams of carbohydrates or less. They could be on a ketovore diet. It's kind of an in-between a keto and carnivore, because carnivore is 0 carbs. A carnivore diet is 10 grams. So I can understand that you would mix up, but a carnivore diet is a ketogenic diet. A lion diet is a ketogenic diet. Yes, in order to get ready for my shows, I ate a ketogenic diet. It was more keto than ketovore, meaning I was eating quite a bit of vegetables and salads spinach during my bodybuilding, getting ready for my bodybuilding shows. I had very little, if any, fat, but a ketogenic diet really doesn't tell anything about the fat, okay? It's more about the carbohydrates. Now, there are ketogenic people who increase their fat. They're still low carb, but they're going to increase their fat, okay, to whatever the amount they want, but that has nothing to do with describing a ketogenic diet. I wish I had been more higher fat, but I got on stage, I did well. It was not a diet I could sustain more than the 4 months. I did it for 16 weeks, and it was difficult. I'm not going to lie, but it was well worth it because I was in the best shape of my life in order to get up on stage and show your muscle. Lucy asks, what is the best way to get B12? Well, the best way is to eat animal products. If you are eating red meat, you're going to get enough vitamin B12. If you're not eating foods, animal products that have B12, then you're going to have to supplement. And I would probably get a methylated B vitamin, and I would take methylcobalamin instead of methyl cyanide. Okay, it's a form of B12. Good question. Thank you. I'm just checking to make sure I didn't miss any questions here. You guys, if you don't put on over there on YouTube, I can see most of your comments. I'm not going to entertain your comments. If you have a question and it's an appropriate question, I'll answer it. But you guys over there on YouTube, if you want to be rude, just go follow somebody else. Okay? Oh, Sashin, that's a great question. So Sashin, who I'm assuming is plant-based because they said they're doing well, but are asking a question in regards to a good B12 supplement that you can suggest. I really don't. My mom actually takes a methylated B complex, and it has B12 in it, the methylated cobalamin, or excuse me, the methylated cobalamin, and she's doing well. We get her B12 level checked on a regular basis. Remember, if you're diabetic, that your B12 is going to be lower. If you're eating if you're eating a lot of plants, you're just not absorbing B12. So, Sashin, I would make sure that you're getting your level checked and make sure that you actually need it. A good level, I believe, of B12 is close to 1,000. You know, we are allowing, doctors have this reference range of anywhere from 200 to maybe 800 at the max. And if you allow your B12 to get down to 200, your brain is not going to function. It isn't. And we are, I think we are allowing this because we are group thinking as doctors, and we abide by the reference range, and that reference range is an average. That is an average of all the sick people that is going into the lab. So you're getting people anywhere from a 200 to a 600. You could be testing a whole bunch of people with depression and Parkinson's and MS, any other brain disorders, bipolar and schizophrenia. And we're assuming those are normal levels. I do not believe they are. So I would look for the best methylated version of your B vitamins. And I can't really comment on what that brand is. I don't know, and I haven't researched that. How's my mom doing? She is stable. She is enjoying life. She loves to go for walks. We have changed much of her diet. She's eating more. We've gotten rid of much of the polyunsaturated fatty acids. So she was consuming a lot of PUFAs, and we have changed that. She's eating much more red meat, and I think it's made a difference in her well-being. But yeah, she's stable. She hasn't reversed, and for all the conditions she has, Lucy, I would say that she's doing quite well from a doctor's perspective. Lion says, do you think plain Greek yogurt has any benefit for someone on a ketovore diet? I've been hearing more positives about this type of your yogurt. So tell me, what are the positives you're hearing? What do you think that a plain Greek yogurt has a benefit for you? Carlos says, your legs in that picture are bigger than mine. At 76, how can I get muscle in my legs? You need to consume protein and do resistance training. If you do not lift weights, this is a great question. This came up actually. Carla, thanks for your question. But many people think that if you eat protein, just eat protein and do nothing, that you will build muscle. You cannot. You have to stimulate growth by lifting weights. You have to do resistance training. You cannot just expect your legs to grow just simply by walking. You have to do something over and above what you normally do. If you normally sit and you consume protein, your legs are not going to get any bigger. In fact, they're going to atrophy. At 76, your body is in atrophy stage. You're sarcopenic. You have no muscle. It's going down if you do not exercise. You need to do resistance training, and you need to consume enough protein in order for your muscles to gain amino acids to grow. Okay, so yeah, my legs might be bigger than yours, but at that time, I was lifting a lot of weight and I was eating a considerable amount, probably double my weight in protein. Lucy, that's a good question. What part of the brain is in charge of memory? It might be the amygdala. I don't believe it's the hippocampus. That is, it might be hippocampus. I think that's where our dopamine receptors are. Is it the amygdala? I can't remember. Go look it up real quick and let me know. But I can't remember. That's a great question. I don't like to be wrong, but I like to give a guess. Yeah, Lucy, I don't know, but if you want to Google it, let me know, let everybody know what the answer is. Okay. David says, did you know people don't think at all? I do know that. And that's part of what I do these live streams for, is to encourage us to think. Okay? For instance, I had somebody who looked something up on AI, and we were simply talking about the absorption or lack thereof of vitamin D. Now, vitamin D, most of us think of it as a vitamin because that's its name, vitamin D. But it's actually a hormone. And a lot of things can disturb the absorption of our hormones, vitamin D. With that being said, we were talking about an obese patient versus a lean patient. And they said that they're aware of this. How about this? They're aware that if we have sun exposure to the skin helps us through enzymatic processes make and absorb vitamin D. But they went on to say that a chronic disease, such as obesity, decreased because of their skin doesn't absorb the sunlight like a leaner person. So what that says to me is the skin of a lean person is different than the skin of an obese person. That is not true. Their skin is no different when it is exposed to the sunlight. Now, the absorption of vitamin D is different in an obese person versus a lean person. Remember that vitamin D is fat soluble. Vitamins A, D, E, and K are fat soluble. If you have fat on your body, you are not going to be able to use that because the fat on your body is going to sequester that vitamin D. It's going to wall it off. It's not going to be usable. Okay? There are other things that can lower vitamin D. If you have low magnesium, you could have lower vitamin D. If you have high calcium, you could have low vitamin D. So hypercalcemia you could be vitamin D deficient. I think that this is very important to know when we're talking about the reference ranges, just like we were talking about the B12 level and session. When we're talking about calcium levels, a calcium level on most labs has a reference range, not an optimal range, a reference range up to 10.5. I would never let anybody's calcium get above 10.0. Why? Because that calcium is too high. And if that calcium is like that, I am going to first check a parathyroid hormone. I'm going to get an intact PTH. Intact PTH. I want to know if they have a parathyroid gland tumor that is increasing calcium. So basically that calcium is coming out of bones. A person who has calcium leaching out of the bones is set up for a fracture. So we need to look into these things and say, instead of saying, oh, my calcium is fine, it's 10.1 or 2 or 3 or 4 or 5. No, that's not. It should be looked into. You should at least get a parathyroid hormone, intact PTH. I have picked up so many parathyroid tumors, and obviously they had them taken out and they're doing quite well now, but I don't think doctors are looking and people are sitting around with parathyroid tumors. Why? Many things could be explaining that. I think it's important also to note that we should not be just indiscriminately taking vitamins and minerals. We should actually have them checked. Okay, Lucy says the main star for forming and organizing new memories is the hippocampus. It's deep in the brain and is crucial for turning experiences into memories. Awesome. So Lucy, I thought either hippocampus or I thought the amygdala. So I kind of halfway got it right. I did not know. Osanda says, me and my wife are trying to have a kid. Been 3 months, nothing as of yet. How long does it usually take to conceive? We are both in our early 30s. I mean, there's a lot of things that can go into why you're not getting pregnant. Usually, most doctors will check the male factor first. They'll check the sperm, the count, as well as the health and mobility of the sperm. So I'm guessing that you've already had that done, but maybe some docs won't check that until a year's time. So couples can be infertile for a year, upwards to a year, before doctors will really look into it. They'll say, I'll just keep trying, but male factor is usually the first thing that doctors will check, or they'll likely refer to an infertility specialist, but usually not before 1 year's time. If the female was on birth control pills for years, that can decrease the ability to become fertile. Not that it's impossible, because I've seen women who are been on birth control pills miss one day and get pregnant, but everybody's body's different. The diet of the female plays a role. If they're anorexic or bulimic or having an eating disorder, the chances of getting pregnant are much lower. If they are consuming a plant-based diet, the chances are much lower. You see, there's not enough fat and protein in a diet. I have seen women get pregnant after not being able to get pregnant on a high-fat, moderate amounts of protein, animal-based diet. And that is, that was wonderful. So maybe you can try some of those things, but I would have your doctor look into why you guys are unable to get pregnant. But, 3 months, that might be just normal. Miss Stan says, my husband has stones in his salivary glands. They are so big he has to get a surgery to get them out. Does that mean he has too much calcium in his body? Well, you have to decide what kind of stones he has. What are the stones that he has? And also, did you get a calcium level? Get a blood calcium level. Paul says, I've seen a 56-year-old woman give birth. Yeah, it's possible. If she's fertile, she's fertile. Miss Stan says it's so hard to find a good doctor. That's why you need to be an advocate for yourself, and you need to look things up yourself and go into the doctor's office or appointment with notes. Go in thinking and saying you want to have a conversation with your physician and you want to do it together. That is what's hard. We, as doctors, the other day I talked about this on a reel, but as doctors, we have ways, 3 main ways that we have a doctor-patient relationship when it comes to treating our patients. One of them is what we refer to as a paternalistic view or a paternalistic doctor-patient relationship. That relationship is basically doctor knows best and they tell you what to do. There's an informative type of doctor-patient relationship where the doctor supplies a bunch of information and then allows the patient to have autonomy and make a decision. And then there's one that's called imperative doctor-patient relationship. And I would refer to that as a shared decision-making process, a shared decision-making way of having a doctor-patient relationship. So if I was your doctor and you asked me a question like, hey, we can't get pregnant, it's been 3 months, and I would give you considerations like I gave you right now, with the implication right now that this is not medical advice. This is for information purposes only. I'm not your doctor. You're not my patient. This is not medical advice. But I informed you as anybody can inform you. They could have read AI Google as easily as you can read AI Google, and you Google all of the things that can make people infertile, not able to have a baby. Okay, so I named off and I would give you this information, blah, 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 blah. Okay, then I could give you some information on how to diagnose the infertility. And then with a conversation with Miss Stan, we would come to the conclusion that I want, he wants to check his sperm count and motility and save the remainder of the check for his wife, because doing the female check is more invasive. Doing the male check is much easier. Or you might elect to change the diet of both of you and try it another month or 2 months. You might get a fertility kit. You might go into checking your temperature and, finding the most opportune time to conceive. These are all things that you can do, and we're having a conversation together, and you are saying, oh yeah, that's a great idea, or that's not a good idea. That's not going to fit into our lifestyle. I can't just leave work, or I can't do this, or I'm traveling, or whatever it is, okay? So I have to first know you and know what your priorities are, what you want from life, how much are you willing to give up to get whatever it is you want. Okay, those are all questions in a shared decision-making process with your doctor. And yes, I think in modern times, finding that imperative type doctor, the shared decision-making doctor, is difficult because doctors are seeing 40, 50 patients a day. They might have 5 or 10 minutes with their patients, and they are in paternalistic mode. This is doctor knows best. You don't need to know anything more. So basically the doctor's also only telling you what they think you should know. That's paternalistic. Informative is a little bit different, okay? If I supply you with all of these things, you got pill A or you got pill B. Here's what pill A does. Here's what pill B does. Here's the pros and the cons of each. Then I allow you with autonomy to make the decision that best for you. I probably practice that mode more so than any other mode because I think I am a teacher. Now, what always occurred after I've given that information, instead of them making it an autonomous decision, they go, "What's your opinion, doctor?" Like off the record. What would you do? And that's hard for anybody. But if we talked about it back and forth, and I gave them enough information and the differences, and we talked about it, and I know what their family's like, and I know what they would do, and I'll say, hey, why don't we do this particular way? How do you feel about that? Does that match your goals or your what you want in life? And usually that inspires the person to feel autonomous and also say, doctor, I want to be autonomous, but yet I need your guidance. And so that I think is perfect. And maybe I lean between the informative and the imperative doctor-patient relationship because I do like to know my patients. I was only seeing at most 15 patients a day. I could spend a lot of time with my patients and we could have these types of conversations. And so, Ms. Stan, I'm sorry that you're having trouble finding a doctor, but maybe finding a private doctor that really is not motivated by the number of patients they see because that is money driven. The more patients you see on an RVU revenue value unit payments side of things, that's how doctors are getting paid, usually by RVUs. The more patients they see and the more charges they have, so you can upgrade the charges by how many bullet points. Okay, let me go through this. Since you've opened up a can of worms here. So if a doctor is being paid on an RVU system, revenue value units, they are paid by the corporation they are working for. So if I see a patient and I charge you a level 4, that level 4 is worth a certain amount of RVUs, okay? And the corporation pays you according to these RVUs. And they'll usually pay you ahead of time before they're even paid. So they know in their mind or in their program how much an RVU is worth. Now that can change. If 6 months they're overpaying a doctor, they're going to change the value of the RVU, okay? Because insurance isn't reimbursing them as much as what they're paying, or they want to scalp the doctor and make more on their side. That's beside the point. But a physician who works for a corporation and is paid by RVUs, they're getting money by what they charge a patient. And then if they charge a level 4, their notes or their progress notes need to qualify for a level 4. Time spent, the amount of bullet points. So basically the amount of dictation they do that satisfies a level 4, now it qualifies. Now they can turn that into insurance and get paid. So if I see you for a cold and I see you for knee pain and you also tell me you got a rash, that could, because you got 3 different things that you're coming into the doctor for, and I spend that time with you, that might be a level 4, as long as I hit all of the bullet points, okay? Now, I was on my own for 13 years. So I was corporate, getting paid by RVUs, made a very good living. And then I see a patient, I document these things. It might be a level 4, just like it was before, but my reimbursement from the insurance companies is a lot less. They will pay a corporation much more than they will pay a single doctor, because we actually, as single doctors or just, on our own, don't have to jump through all of the hoops of all the other things. So they say, you know what, you don't want to play our game, we're not going to pay you. And they can do that. You sign a contract for payment. You can renegotiate, but then if they look at what they've been paying you and they think, you know what, we're actually overpaying her. So you wanted to renegotiate and they renegotiated even lower. I've had it happen. It's not a good feeling, okay? So it makes you wonder, should I even renegotiate? Because it gets them to start looking at your stuff. It's a shame, really. Good morning, Dennis. Thanks for joining. Let me see. It must be just your audio because mine is up as loud as it can go. So thank you. Lion says, I hear it's great for gut health. A lady who lived to 117 ate Greek yogurt daily for most of her life. Doctors said her gut health may have helped her healthy longevity. So now you're talking about the difference in, you're talking about the microbiome, the gut biome, and you're saying, so if that woman is eating Greek yogurt, you're saying that you need the biome that's in that Greek yogurt, which is probably pretty minimal, okay? So people think that they're actually getting a whole bunch of probiotics by eating fermented Greek yogurt. Could you be? Yes. Is it enough to change your biome completely? Probably not. You are putting, a dairy into your body, which you likely have a reaction to, whether you know it or not. The casein and the whey will cause reactions because, really, after a certain amount of time, we don't break down lactose. And lactose is in dairy. The lactase enzyme that we were born with after about the age of 5 doesn't work so well. Now, we can tolerate dairy, but likely that 117-year-old living that long was not simply due to that. I mean, use your brain, Lion. If everybody just ate Greek yogurt, they're going to live to 117? No, I doubt it. She was probably a praying woman. She hung out with positive people. She had good family support. She was exercising on a regular basis. She slept 8 or 9 hours a day. She got out in the sun. Are you going to eliminate all of those factors and say, you know what? This woman lived to 117 and I think I'm just going to eat Greek yogurt. And that's got to be the key. So what you're assuming, speculating, insinuating is that your gut biome needs to change in order to live to 117. Now, Lion, I know you and I know that that's not what you're thinking. You're trying to think that, hey, if I just change my microbiome, everything will be great. What is wrong with your microbiome? Now, if you are eating a bunch of carbohydrates, I would suggest to you that you might need some Greek yogurt or some kefir, however you want to say it. I would never eat the yogurt when I could eat kefir because it's already fermented even more. I'm going to get more probiotics. I'm going to get an organic, plain, whole kefir. That's if I thought my gut biome was not good. So I think that we're assuming, and you're getting bought into, I don't want to say a radicalization, but you're group thinking, okay? They're doing a good job by convincing you. It's the same as how people do it with supplements. Oh, this person lived to 117 and they took all of these supplements, some D and some C and some B complex and some spirulina, and they took some LG and they took omega-3 fatty acids and they did this and they lived to 117. So I'm going to do it. That is an echo chamber. That's groupthink. That's a part of radicalization, to be perfectly honest, because they isolate you. They get you thinking that you're no good, and that in order you want to live, so they're going to assume that you really want to live to 117. Okay? I'm not saying you do or you don't, but they're going to isolate you, and they're going to put you in contact with nobody who's on the other side. Like, let's just say I get you to start thinking and say, really, do you really think that just Greek yogurt every single day? And how much? Is it 1 ounce? Is it one little container? Is it a certain brand? Is it only this one? Is it only at 10 o'clock in the morning that it works the best? If your biome is a problem, it's what you're eating. So it's not what you eat, it's what your biome eat. If you feed your biome this, it will have this. If you feed it steak, it's going to live on steak. If you feed it a bunch of fiber and you eat carbs, your biome is going to grow those bacteria that eat those things. Do you think a carnivore biome is going to eat carbs? No, you're going to develop other things. So if you have a mixed diet, you're going to have a mix of probiotics, or biome, I should say. Your biome determines your what you eat, okay? It's not what you eat, it's what your biome eats. If your biome eats carnivore, you're gonna metabolize it and use it for energy. You see, Playing, but that will get loud, so I put a nix on it. So, the doctors can say, oh, it's about our gut health. Well, sure, go eat fiber then. So that's what they're going to say. First it's the Greek yogurt, then it's fiber, then it's spirulina, and then you got to get some algae, and then you got to take some omega-3s, and then you got to take amino acids, and then you got to do this and this. No, I can't get on board with that. Carla says, I'm going to start going back to the gym next week. What would be the best type of exercise besides walking for me to start with? Carla, it sounds like, you might need to get a personal trainer, but, I would do machines first, and I would go through a circuit, and I would have somebody show you how to go through those, to how to use them, a reintroduction to using the machines. I would stay away from free weights at this point, if you haven't been in the gym for a long time, and I would do, a circuit training, and I would get really good at that. And I would try to do reps and sets to failure, just doing 20 pounds with leg extensions or a leg press is never going to stimulate your muscles to grow. You could probably sit there and do a 20-pound press 100 times. That's not doing anything. You need to stimulate your muscles and go to failure. That could look like 10 reps. And it could be hurt. It could, that muscle working could give you some pain. Not bad pain, good pain. Not pain, I hurt myself because I was lifting too much weight, but pain like, oh my gosh, my muscles are burning. They're growing. So then you go home and you feed them good protein and good fat, and they get stronger. It's not what you're doing in the gym that causes them to grow. It's what's occurring outside the gym. So if you're feeding them good amino acids and good amount of fat and you're resting them, then they're going to grow. They're going to regain some strength and size. So yeah, I would do circuit training. Okay. I'm trying to read the questions over here. There's no cues, so I'm just gonna skim through all of these over there on YouTube. So if you have a question, David says, don't forget the bonuses they get from giving new prescriptions to patients. Okay, David, it's not quite that simple. It's not a doctor writes a prescription and then is somehow getting a check in the mail. That isn't how it works. You see, insurance companies have guidelines, and they want doctors to follow guidelines in hopes that it will keep patients healthier. For instance, if a guideline is to keep the LDL cholesterol, your LDL at 100, and the person is at 160, because if I check somebody, okay, not I, if these doctors check the cholesterol panel, and the insurance companies knows that you check their cholesterol panel, because eventually it's going to ask for the results. It's going to get the results. So if the insurance company asks for the results and it sees that you let a 160 LDL go and you did not put that person on a statin, then you're going to usually take a decrease in pay. Now, if the corporation signs a contract with an insurance company, they're going to have all of these guidelines, like LDL under a certain amount, your blood pressure under a certain amount, your diabetes under a certain amount, the A1C. And if all of the doctors do all of those things, and so this is why they get auditors. There's independent auditors, because the reimbursement, or you call it a bonus, but the reimbursement that a corporation will get from an insurance company is pretty high if everybody is following guidelines. So if all of the doctors in that particular corporation is getting everybody to goal at 100 by putting them on a statin, getting everybody's blood pressure down to 120/80 by putting them on a blood pressure medicine, getting everybody's A1C at whatever goal they have, 7 or 6 point, whatever the insurance company says, then the corporation gets a bonus. And then the bonus is diffused onto the doctors. So if you do good, doctor, they pat you on the back and you get a bonus. I don't know if you want to call it a bonus, but it's part of their package. It's part of their, what do you call it? I'm having a brain fart, but you know what I mean. I don't necessarily think I want to call it a bonus, but it is part of their reimbursement package, okay? And if you don't follow those guidelines, it is a strong possibility that you could be docked, meaning pay would be diminished, because your corporation is going to see, hey, you aren't putting all these patients on statins. How come? If you don't start doing it to get them to goal, we're not going to meet the guidelines for the insurance company, and therefore we're not going to get. So if you stop being the good old girl or the good old boy doctor, you could be, your resignation could be accepted. They're not going to fire you. They're going to accept your resignation because you resigned. Right, doctor? Right. My mom just joined. Hi, Mom. Okay, Lucy says, all good, audio's fine. Hippocampus is the area responsible for memory. How can we improve or protect or make sure? You know what, Lucy? Anything that protects our brain is going to be in our best interest, okay? So our brain has cells, and I think I went over these. This is, God, what day was that? I have these in days, you guys. I have my notes with me. I like to have all my notes for the week because usually you guys will ask questions from the week's reels, and I like to be prepared. But since I'm not prepared with that one, I'm not prepared with that one. Okay. Our brains have cells, and those cells need nourishment. If we want to have a nourished brain, we don't want to continuously give them energy that is being a disruptor. So if caffeine is a disruptor, it could be individual. You don't necessarily want to hyperstimulate your brain, the nervous system, the sympathetic nervous system with caffeine. Now, your brain can make its own cholesterol. It really doesn't have to rely on what you eat in the form of cholesterol, just so you know. I know that a lot of you will say, yeah, but our brain is made of 60% fat and we should be eating fat to get the fat. Now, I'm not telling you that you shouldn't eat fat. I think that's very important. And a good saturated fat is really the best kind that our body uses because we can use that fat to make ketones. Now, remember, the blood-brain barrier is very, very tight, and large molecules cannot get through, meaning cholesterol is a large molecule that cannot get through the blood-brain barrier, and that is why the brain actually has to make itself. So God made our brain's ability to make its own cholesterol, okay? Now, it also needs an energy source. You might think that energy, the best energy source would be glucose. It is not. It's actually ketones. If the brain is swimming in a pool of glucose and ketones, it will choose ketones first. It will choose glucose second. But if there is no ketones, it's always going to choose glucose. You cannot get ketones if glucose is high in your body because insulin will be high. You cannot break down fat in your body, on your body. You cannot break down fat in the presence of insulin. Okay? If insulin is high, you will burn glucose. If insulin is low, you will start breaking down your fatty acids, and making ketones. Those ketones are an energy source for every organ in our body, including our brain. Now, what if you took exogenous ketones? Meaning, I'm going to go buy some ketone IQ in a little bottle, and I just want to continue eating what I'm eating. And I'm going to drink one of those every single day to keep my ketones up. Will the brain choose the sugar because you didn't change your diet, you're eating a bunch of carbs, or are they going to choose the ketones? They're going to choose the ketones. Your brain could be healthier on exogenous ketones, but those ketones do not change your insulin. It doesn't feed back and say, hey, there's ketones on board. Insulin, you don't have to be high anymore. No. The insulin is high because you have sugar on board. So you could be taking in a whole bunch of exogenous ketones and your diabetes is getting worse and worse and worse and worse. And your fat cells are growing bigger and bigger and bigger and bigger because when sugar's high, insulin is high, and insulin causes growth. Now, if you have a bunch of muscle on your body and you're a muscle person, your muscles are going to accept some of that glucose. But if you're not, and you have just a normal body habitus, which is usually more fat than it is muscle, then you're going to make more fat. You're going to get fatter. Your fat cells are going to grow bigger. That's called hypertrophy. And those fat cells will continue to grow until they get resistant. They say, I'm done. I'm full. I can't take it anymore. They don't want to get any bigger. But we try to cause them to explode even more because we're so hungry, we just keep eating. And those fat cells, over time, will begin to leak. And they leak naughty stuff out of the fat cells. Inflammatory cytokines and interleukin and all of the things, the debris that's inside fat cells starts to leak out. That is the only time that we could leak out fatty acids, lipolysis, in the presence of high insulin. Because usually, if insulin is high, you do not break down fat. There is no lipolysis until you continue to drive those fat cells even fatter, and they will start to leak or burst or whatever. And out come the fatty acids. That's why, these people have extreme amounts of fatty acids, and guess where they go to? That is where we start getting ectopic fat distribution. So it's now no longer just underneath your skin fat. Now it's going other places. It's going to your liver and your pancreas and your tongue and your heart. You're getting fatty organ disease. Now you're set up for all of the chronic diseases just because you kept the energy source coming in. Okay? So how do you improve your brain? Give it what it wants. It would like ketones. How do you do that? Stop eating carbs. That's one way. Sleep better so your cortisol is lower. Decrease your sympathetic tone, avoiding stress and nervousness and anxiety. Practice calm, where your parasympathetic nervous system is more active than your sympathetic nervous system. They need to be in balance, but we live like this with a sympathetic overdrive. We are in fight or flight all the time. And parasympathetic wise, we can't balance. So now we can't really change this, but we can start increasing this by practicing exercises to increase parasympathetic tone, parasympathetic nervous system, which is calming. Sympathetic, fight or flight. Parasympathetic, calm. Whew. That is just the way we're living. And is that hard on our brain to be overstimulated all the time? Absolutely. You can't even rest your brain when you're sleeping because your sympathetic nervous system is high. Your cortisol is high. Everything is causing you to be sick. Dennis asks, what about L-reuteri and SIBO, small intestinal bowel overgrowth, fermented dairy? What's the question? What about L-reuteri? Okay, that's a microbiome bacteria. And SIBO and fermented dairy? Is that a question, or are you telling me that that L-reuteri from fermented dairy? Why do you have SIBO? Why do you have small intestinal bacterial overgrowth? Dennis, it's from what you're eating. So those people who have SIBO are eating a bunch of sugar, okay? They're going to eat the sugar, and they're going to cause an overgrowth of bacteria that eat sugar. So you're thinking, oh, I'm going to continue eating the sugar, glucose, and I'm just going to take some L-reuteri. Again, I have diabetes. I'm going to just take the medicine and continue to eat the carbohydrates. I have alcoholism. I'm just going to drink alcohol in moderation. I mean, instead of adding to our problems, how about you deprescribe? There's nothing miraculous about a carnivore diet. There's nothing miraculous about eating meat and eggs and butter and bacon and whatever meat you want to eat. It is what you take away where you get your benefits. Yes, I want you to consume an animal-based diet. But in the process, if you're eating a whole bunch of carbohydrates, you still have a risk for getting all of our chronic diseases. You're going to get insulin resistant over time. And you call that aging. I do not. I call that you wrecking your body. And if that's what you want to do, and you think you want to, ask why the person has SIBO, Dennis. That's what you need to do. Lucy says, we love kefir. Is it best an empty stomach? I sip 1 ounce in the morning. Why do you consume 1 ounce in the morning? Good morning, Sheila. The other Lucy says, I put on 2 pounds of muscle since July. Only lost 1% body fat. Gotta trust the process. How many calories did you eat during your bodybuilding days? Oh, I was probably getting 200 grams of protein. So that's times 4 is 800, right? And then I probably add, it was probably 50 grams of carbs, maybe 40. So 40 times 4 is another 160. Yeah, probably 1,000 calories, Lucy. I was a hurting unit. Yeah, I was hungry all the time. I ate all of my calories in probably 5 different meals so I could keep my mind about me. I also did MCT oils during some of my shows, not all of them. So MCT helped to feed my brain and keep it adequate. It was a great energy source. I would actually put a little bit of baking soda with my MCT oil because I always got a stomach ache with the MCT. I mean, obviously the foods that we were eating would cause anybody's stomach to be upset, but you know, that's just what we did. And so not always did I do MCT, but a lot of times. Okay. I'm just trying to read through. I'm looking for cues on the YouTube. Troy says, staying away from carbs in America is like trying to stay away from a swarm of bees. They're everywhere. Well, I guess if you're eating an animal-based diet, you will not be consuming carbohydrates unless you're eating a bunch of dairy with your animal-based diet. Midas Touch, thank you. Mr. Farrell, I understand what you're saying, but you have to keep in mind that this is a 76-year-old woman who has never been in the gym or has ever lifted weights. And you're just saying it's just simple. Just if you want to do legs, you'll do a squat. If you want to do your upper body, you'll do a bicep curl. You're assuming or insinuating that she knows what a bicep is or a tricep or a deltoid or whatever. So yeah, you know what? Maybe you're telling me that I need to go read. I guess you've never trained or been experienced. Maybe you're not 76. I'm guessing you're only 20. Your brain is only halfway developed. Eve says, I get, wait. My body craves watermelon and green grapes when I'm keto. I don't get I would see what chemicals are in green grapes and watermelon and what you're craving, but I'm guessing it's sugar. Yeah, Lucas, I agree. They are changing. In fact, the American Association of Cardiologists just changed the blood pressure goal to 120/80. That everybody needs to be at 120/80. It used to be 140/90. Then it went to 130/80. Now it's 120/80. Okay, I'm just going to spin through all of the YouTube comments over there. I appreciate you guys listening. If you haven't subscribed, subscribe if you find this interesting. So I'm going to stick over here. Dennis says the first step is to go keto or carnivore. Well, carnivore is keto. it is a ketogenic diet, but you will still need to restore your microbiome. Yeah, it takes about 2 weeks, Dennis. So if you want to eat some yogurt at that time, you know, take a bite of a steak and take a bite of your Greek yogurt, that's fine to get your biome. Yeah. Okay. To go back and talk to Carla a little bit about, 76-year-old, not been in the gym or maybe never been in the gym, wanting to know some exercises, going to walk. Safety is paramount, okay? And that's why I suggest maybe getting a trainer or have somebody show her the machines. Now, because at 76 and we got sarcopenia, or really after the age of 50, our muscle mass is likely starting to go down. It is much worse in women than it is in men, but we have to understand that our bone composition is also going to take a hit. If we are not consuming enough amino acids through protein, our bones are going to be weak. We are set up for osteopenia and osteoporosis, okay? So 40% of our bone composition is made from protein. The rest is minerals. And, we always think, oh, it's calcium, it's calcium, it's calcium. We need to take more calcium. That can just get you into more troubles. If you're consuming calcium, you're going to get hypercalcemic. And then hypercalcemia is going to end up feeding back and telling the parathyroid to go down. And then that's going to tell the vitamin D to go down. And your zinc is going to go down. And your magnesium is going to go down. You guys, we need to make sure that what we are taking has been tested first before you just go and start taking a bunch of supplements. Get your blood work done. But Carla needs muscle mass to tug and strengthen her bones. So doing weight-bearing exercises is going to help. So Marnie says, yes, be careful and go slow, working out at first. I agree. Marnie says, I jump in too fast and end up getting out of alignment or getting hurt, having a muscle ache and pain. It's common. So we don't want to scare you, Carla, but we want to encourage you to take it slow and walk and do weight-bearing things. Do machines, do air squats, do sit to stand. One of the things that I like to teach my seniors is getting up out of a chair without using your hands. So you sit down, stay tight, stand back up. You're using your posterior chain. You're using your glutes and your hamstrings. So as we age, our posterior chain gets weaker and weaker and weaker. And that's why we have trouble getting out of our chair as we age, because our glutes and our hamstrings are very, very weak. So working posterior chain is important. We can't see it, so we work less of it. That's why getting a trainer helps, as long as the trainer is educated. But yeah, working glutes and hams is important. So sit to stand, sit down, stay tight, don't relax, stand back up, use no hands. At first, you might use your hands. Push up with your triceps. Good morning, Alonzo. So here's a question. How do I keep my mitochondria healthy? Well, that is a deep question, but let me just say, minimally, your mitochondria need magnesium, okay? They also need CoQ10. They also need niacinamide. They also need carnitine, okay? They also need D-ribose. They also need stimulation and then not stimulation. A mitochondria that is always under the influence of an energy source coming in is going to basically wear out the mitochondria, so to speak, okay? I don't want to I don't want you to take that literally, but there are certain things that the mitochondria need in order to stay healthy. And if they're always having to deal with energy, especially in the form of glucose coming in all the time, the mitochondria can actually become insulin resistant as well. And just like any cell in our body, and inside the cell can become insulin resistant. And organelles, like the mitochondria, can become insulin resistant. Okay. All right. For the last 3 weeks, I have been fasting for 60 hours a week, and my ketones have gone up from 4, 5, 6. Glucose dropped to 60s and 70s, putting me into serious ketosis. Or, Dennis, are you not using your ketones? So you should be in ketogenesis, right? You're in ketosis. You're fasting, you're having autophagy, I don't know what 60 hours a week looks like. Is that, less than 10 hours a day you're fasting every single day? Are you doing a 24-hour fast at one time? I mean, fasting looks like a lot of things. I could divide 60 into don't eat for 3 days, eat for 1 hour. I mean, you have to be more forthcoming with information, but if you are in ketosis and your ketones levels, so let's just say you've been in ketosis, you've been fat adapted for a year, your ketones should not keep going up. That means you possibly could not even be using them. So you're not even using them as an energy source. So what are you doing? Something is going on. That ketone should not be like that. I could see them at 1 or 2 if you're fat adapted. You would think that your body fat would be next to nothing as well. Okay? Are we digging into muscle stores? Do we have high cortisol? Are you sleeping well? Are you breathing well? Lucy says, Dennis, do you fast 60 hours continuous? Good question, Lucy. Lori says, go through the mitochondrial needs one more time. Lori, you can search this out too, but I'm just giving you just minimal ones, okay? The magnesium is needed for the mitochondria to go through their process, okay? Magnesium. CoQ10. CoQ10 is a necessary molecule needed for the mitochondria. If a person is taking a statin, they're not permitted, if you're on an HMG-CoA reductase inhibitor, a statin, you are not going to make CoQ10. And doctors should be telling their patients to take CoQ10 if they're on a statin. If they're not, then they don't know the pathway of the mevalonic pathway and what the mevalonic pathway produces. CoQ10 is one of them in the HMG-CoA pathway. So if we're taking a statin and it's blocking that, now you are a setup for no CoQ10. And that means that you are putting your mitochondria at risk. Just one simple molecule like CoQ10. You're putting your mitochondria at risk. Anytime that we have more reactive oxygen species, so more oxidative stress going on, our mitochondria are in a detriment because there's not enough antioxidants to take care of all of the ROSs, all of the oxidation that's going on. We need oxidation. We just have too much oxidation in many people, okay? So magnesium, CoQ10, niacinamide. A lack of niacinamide doesn't tell you, oh, I'm just going to take niacinamide, which is basically a B vitamin. you don't just take CoQ10. Your body should make CoQ10, unless, of course, you're taking a statin. Then your body's not making CoQ10. L-carnitine. If you are a plant-based person, you're not going to get enough carnitine. You need to either take it as a supplement or eat meat. D-ribose, a type of sugar that our body needs, the mitochondria, in order to do its thing. Those are just simple things. What poisons the how about we talk about that? Like, what is poisoning our mitochondria? Sugar, glucose. Remember, glucose is oxidizing, it's glycating, it's causing more reactive oxygen species. Dyes and colorings, heavy metals, plants, which have oxalates. When we first started this, plants have oxalates, phytates, tannins, saponins, goitrogens. All of those are poisons or toxins to our mitochondria. Metformin, medications. Metformin causes toxicity to our mitochondria. Well, I got to take metformin for my diabetes, though. What caused your diabetes? You just don't want to stop eating the foods that cause your diabetes? You want to keep your diabetes, take the metformin, have mitochondrial toxicity. That's fine, as long as you have enough information to make a good decision. I can't recommend that. So Dennis says he does 60 hours straight. Carnivore Peter says, it was great to connect this week. Hopefully we can do a call sometime. I would enjoy that. Yeah. Yep. Let's do some sort of a live together and do question and answers. People love that. They love the ability to listen to people talk back and forth, even if we don't always have the same ideas. You know, there's many plant-based people on here and they're thriving. As far as they're concerned, they're thriving. I can't determine whether or not they're thriving. They're saying they're thriving. I believe them. Now, if they want to get some labs and have me look at them, I will go over them. If they know they're eating a plant-based diet and they're not getting enough B12, they're going to take B12. If they know they're not getting carnosine, creatine, and carnitine, they're going to take it. They know. Or they're going to try to make a complete protein by mixing and matching the different plants. It's possible. But a plant-based person who only eats watermelon is going to be deficient at some point and likely not thrive. Likewise, is it possible that a carnivore person eating only ribeye steaks could be low on some things? Yes. They might want to add some organs to their ribeye steaks. They might want to add an egg. They might want to, I don't know what they want, okay? But Melanie says magnesium L-threonate crosses the blood-brain barrier. Yes, it is one of the only forms of magnesium that does cross the blood-brain barrier. So what Melanie is referring to is there are different salts of magnesium. There's magnesium oxide, there's magnesium citrate, there's magnesium malate, there's magnesium L-threonate. There's all of these different types of magnesium, and their absorption rate is actually different as well. So if you're taking magnesium oxide, usually people take magnesium oxide or take magnesium citrate for bowel movements. It's not readily absorbable and usable for all of the things that magnesium needs to be used for, i.e. your mitochondria. So it is important that you maybe get a combination. Maybe you want to get malate and orothate and L-threonate. You want to get all of them in a combo. Or if you're saying, man, I just really want to fix my brain function, I'm going to try just the L-threonate and see if it helps. I mean, A lot of times people will get symptoms of low magnesium, and that could represent in a headache or neck pain or leg cramps. People get all kinds of, but one of the most common things that people will complain about is a migraine, a headache, and you give them L-threonate magnesium and their migraines seem to ease, disappear even. And so then they are able to get off of their medicines. I mean, it's just crazy that we're missing as doctors with just like legal, drug deal, CGRP inhibitor, and we're going to give you this, and you're going to take this, and then we can give you a long-acting one. Just take this one every single day. But what is causing a low magnesium? What are you consuming that could be lowering your magnesium level? Here's a big one. Is it possible that you could have a buildup of iron in your liver and that is lowering your magnesium levels? I think that's a possibility. Do doctors look for pent up iron inside the liver? The liver is usually the first to go when iron is concerned. If we are over consuming non-heme iron in the form of plant non-heme iron, so you're eating a bunch of plants, or you're eating fortified processed foods, or you're taking synthetic iron, which is non-heme iron. So all of the plant people don't know that they are sequestering and locking up non-heme iron in their liver. They don't know that. They have probably been told that their liver is fine. Their magnesium level might be low because their liver iron is high. Liver iron high, magnesium is going to be low. Your doctor could say, just take a magnesium supplement. So you continue to eat your plant-based diet and eat your processed food and take your synthetic iron because they told you your iron was low. Why? Well, my ferritin was low. Well, did they check a transferrin? Did they do a TIBC? Did they get a hepcidin level? Did they check your MCV? Likely not. They didn't do any of that. They checked your hemoglobin. It was low. They said you're iron deficient and gave you iron in the form of non-heme iron that we can't absorb, maybe 3%. So 3% is usable. Where's the rest go? Liver. And the liver, iron, lowers the magnesium. And then the low magnesium lowers your vitamin D. Whoa. Do you see the tumbleweed effect that's going on? Why was your liver iron high in the first place? Could it be because you have low copper? You have low copper in your diet? So you should just take low or take a little bit of copper, huh? Or is there something else that's causing this pent up iron? Either way, you got to get it out because it's damaging your liver. It's making all of the cells more and more insulin resistant. Just insulin does not cause all of the insulin resistance that we got going on. So just not all high sugar diets are causing all of the insulin resistance. No, some of it's heavy metals. What about microplastics? What about diesel fumes? What about burning plants? You're around a whole bunch of wood burning? What about polyunsaturated fatty acids? All of these things lead to insulin resistance, as well as insulin. Insulin leads to insulin resistance. So high insulin, insulin resistance. Iron overload, insulin resistance. It's all affecting the cells. And when you have all of this iron pent up in your organs, especially the liver, which is the master organ, you're rusting inside. You're rusting. And the liver makes antioxidants. And antioxidants are supposed to help with all of the reactive oxygen species that you're making in your body. I know it sounds complicated, but all of these toxins that you have in your body, we have antioxidants. Well, so we should. But if we're doing other things like eating a plant-based diet or taking synthetic iron or eating a whole bunch of processed foods, we're getting pent up iron in our organs. And if it's pent up in the liver, which is the first to go, it's the master organ that makes the master antioxidant, glutathione, then there's no glutathione to help neutralize all of the oxidation that's going on. Or it's used over here when it should be used over here. And so we call all these things chronic disease. And we call it cognitive decline. And we got all these diagnoses codes as doctors. You know, we got the diagnosis of fatigue. We can put it as simple as that, fever, fatigue. Or you got fatty liver disease. Well, no, the fatty liver disease is now, you have to stage it. What's the fibrosis look like? What, do they have cirrhosis? Is it metabolically associated steatohepatitis? Seriously? You're gonna go that deep. Do you know why? Because we get paid. The deeper you go into the ICD-10 code, the better the reimbursement. And they're doing it for your good. And so they'll send you to the GI doctor. And then the GI doctor will put you on you guessed it, medicine. They didn't even tell you about your diet. They didn't tell you why you got fatty liver disease. All you ate was watermelon? Okay. And grapes? Any kind of fruit? On a regular basis, every single day. And you got fatty liver disease. And it choked out your liver. And you got fibrosis. Do you think you're going to get any glutathione being produced? No. Nope. So this iron pent up in your liver, it's a problem. And you can try to chelate it away. You can take EDTA. It's a chelating agent. It helps to bind heavy metals, your mercury, your arsenic, your cadmium. It's going to try to bind them. But what if they're stuck in your organs? Is it possible with EDTA to get them out? Not likely. It is unlikely that that pent up iron is going to get out with simple EDTA. Well, what about just dumping your blood? Same thing. You already told me that the iron was low in your blood. Your ferritin level was low. Your hemoglobin was low. Where's all your iron? It's in your liver. So your doctor's just going to give you more iron. Really? That was the problem. You're giving me non-heme iron and I can't absorb it. So it's getting locked up even more in the liver and the organs. I mean, it's really a crazy thought, but what about checking the copper or the ceruloplasmin level? What about the people who've been told that they have this iron deficiency and given without any look of, and they didn't look, oh, your ferritin level's low. Well, could it be that your ferritin level is low because it's all inside your liver? So a too high ferritin and a too low ferritin are just as bad. But without looking at more stuff, you can never get a good grip on what your actual diagnosis was. Do you think that the doctor could think through all of this stuff in 10 minutes? And in that 10 minutes, you had a knee pain, a migraine, your liver function was elevated? Oh, really? No, your liver function wasn't elevated. They didn't look. They looked at a reference range. Remember, you can go from anywhere from 5 to 45 or 50 on your liver function. Guess what? If you have a 35 or a 30 or a 25, you have liver dysfunction. Your liver is not working very well. Your AST, your ALT, if they're in the 30s, 40s, 50s, that is not good. That level should be in the 10 to 15 range. The doctor never checked a GGT. We said before, they probably didn't check a CBC, which they would look at the MCV. If it was elevated, like above 90, maybe even 89, they would know that their liver's not working very well. But see, I don't necessarily want to say the doctors are ignorant. Maybe they are. Maybe they just never looked. Maybe they're so busy, they don't have time. I don't know the answer. But the correctness is not to let it go and just claim ignorance. Oh, I didn't know. Or I'm following guidelines. Well, the guidelines were made by the exact same people who don't really want to treat your fatty liver disease or your lack of glutathione or your chronic illnesses, because the world of pharma and food make money off of you being sick. If you're all healthy, you're not going to make them any money. They want you eating plant-based and having low iron, and then going to the doctor and getting some non-heme iron supplements, which is making you sicker and sicker. And then that's going to require medicine and medicine. And your mitochondria are going to be ill. And you're going to get Alzheimer's. Well, that takes some medicine. Or you're going to get Parkinson's. There's another medicine. Heart disease, medicine. Hypertension, medicine. Diabetes, medicine. All of them. Medicines. Okay? Lori, thank you for the mitochondria need rundown. You're welcome. Okay, Lucy's heading out for a hike. Awesome. Lori, iodine supplementation. How do we know? I would get your iodine level checked. I would check it. I wouldn't risk just putting an iodine, although there are doctors who will walk you through how to test it on your own skin. You can get a random iodine level. You can get a 24-hour iodine level. There are other ways that you can check an iodine level, but in general, most everybody is low on iodine. There are doctors, I think it's Dr. Bernstein. He has an iodine book, and he's very aggressive with iodine supplementation, okay? Brownstein, I think it's Brownstein. He's very aggressive. I mean, he's encouraging people to take, 25 drops a day. And some doctors out there are just talking about maybe 4 or 5 drops a day. So I really think, Lori, that the levels need to be checked before we go and do anything, okay? Correct, Lucy. A high MCV usually translates into liver dysfunction. Remember, think about the B12 and the folate. Our livers are not, so when we have high MCV, high MCV is describing the size of our red blood cells. And an MCV, a lot of doctors won't diagnose macro, large, cytosis, osis, condition of large red blood cells. Macrocytosis. That's what a high MCV indicates. Some doctors will wait till the MCV gets to 100 before they diagnose macrocytosis. I usually do 90. Anything above 90, that triggers me to look at their liver. It also triggers me to get a folate level and a B12 level. They can be off. But why is the B12 level off? Why is the folate level off? Could it be translate to the liver? I think the liver, and you guys take it with a grain of salt, but the liver, the master organ, is doing the heavy lifting, and we need to look to the liver for all of the answers, I really think. Carrie says, thanks, Doc. Your recommendation, TENS machine is working awesome. Good. Carrie, while you're on, have you ever thought about like red light therapy? I was thinking about this because I actually went and looked at it's called the Heliopet, and it's a wand. It's like a handheld wand, and the Heliopet Pro has a low, a medium, and a high, depending on the amount of penetration that it can do. But when I was reading all the comments, people were actually using it on themselves. So they were using it on their joints. And I was just thinking about your biceps tendon or your shoulder that was causing a problem for you. And I was just wondering if you'd thought about doing, or even cryotherapy, but the red light therapy, if you've had one of those red lights and using it. Heliopet. It might be Helio. I think that's how you spell it. Or is it Heleo? It's one of those. I bet even if you Googled Helio the way you spelled it, pet, it would come up. Enrique says, why are you called Iron Lady? Iron, that name was given to me by my workout partners way long time ago, probably in the early 90s when we started using computers. I don't remember when it was, 1991 maybe, 1992. And my workout partners called me the Iron Lady. And so when we got computers, you have to have a handle. So my workout partner said, you're the Iron Lady Doc. And that's how I got mine. So iron, lifting weights. Lady, obvious. Lady Doc. I am a family practice physician. So that's how I got my name. Thanks for asking. The question was, the best way to get vitamins is through your diet. I would agree, but if your diet is lacking, Melanie, I'm an AOL old timer too. Yeah, I get a lot of crap about that AOL. I have never changed. I do have a Gmail address. I never use it. Do I have anything else? No, just Gmail. But yeah, I have always kept it, and it's kind of now it actually makes people laugh whenever they see AOL. It's fun. And so some of my old timers, they also have AOL, but a lot of them have, bumped up or upgraded to Gmail. It still works. It's fine. And everybody knows me for IronLadyDoc at AOL.com. So it's gotten to me nostalgic, actually. So is a liquid form of vitamins better that you can absorb completely? Well, I guess that could be maybe doing a liquid form, but I would still get your levels checked. Again, those when we talk about any type of synthetic, whether it's in liquid or capsule form, you're still getting non-heme iron. And non-heme iron is, no matter what you say, it's not absorbed. Our body does not use non-heme iron. 3%. Heme iron, we can do 30% absorbed. So when you're eating red meat and getting heme iron, you're going to have a better chance. And we need iron. Your brain needs iron. If it's all locked up and pent up in your liver, do you think that your brain is going to get it? Likely not. Trey says, I feel like doctors should be obligated to do background research on meds. Yeah, I mean, you would think, but again, picture this, Trey, is say there's a guideline for diabetes. Let's just go with diabetes because it seems the easiest to discuss. If the guidelines say that the first drug of choice is metformin, the doctors aren't going to question guidelines. So if they give you metformin and you're getting mitochondrial toxicity from the metformin, as well as a bunch of other things, your mitochondria can go bad from the sugar, the glucose, the fermentation, the caffeine, the alcohol, the heavy metals, the phytates, oxalates, tannins, saponins. You're getting all of that, right, Trey? Your mitochondria are getting that. But as long as the doctor is following guidelines, they're not exposed to lawsuits. Now, you might say, but shouldn't they just do it for the health of the patient? Well, in their eyes, Trey, I'm guessing that they just take credence in the experts that gave them the guidelines. And who are the experts? Who wrote the guidelines? Why are the guidelines changing? Why are we continuing to kick the can down the road and saying, oh, now you can have your A1C at 7 and instead of 6? Well, 7, your pancreas, your beta cells are probably in burnout mode. At 7, you've probably lost 60% of your beta cells. So now you have 40% working for you making insulin. And eventually they're going to really burn out and they're not going to be able to produce insulin. Okay? And that is a shame. And will the doctor get reprimanded or go to court and get sued and say, doctor, didn't you know that blah, blah? I was just following guidelines, Judge. I was following the guidelines. Yeah. Okay. Alex says, a doctor could be liable for a lawsuit if they do not follow the guidelines. Agree. If the doctor is not following the guidelines here in America, if they don't follow the guidelines, they are a setup for lawsuits. I agree. That's exactly what's going on. I know many people who were refused vax exception even after injury. I don't understand your question. I don't have an idea. It's kind of obscure on who is writing the guidelines or who, but there are committees that get together, like the vaccine committees. They get together and they all sit in a room and they go over guidelines, but there might not be any dissent. Remember when we're talking about, groupthink, the first stage is to isolate people. So you're not going to have contact with anybody with any other ideas. So they cause division. So everybody on the guidelines might be isolated into one thinking mode. And then that becomes an echo chamber. So they, in that group, whoever's writing guidelines might be all echoing the exact same things. So they might be associating with the only certain opinions that sound like yours. So if everybody writing a guideline says LDL at 100 is recommended, everybody gets a statin, you've isolated yourself already and they divided you. So you're not going to hear any other like what ifs. Well, what if a statin blah, blah does this or does that? No. We're going to isolate you and there's going to be no division, okay? Well, the division is not within the group. It's actually group to group, okay? So they cause division. Then that's the echo chamber where all of the opinions are going to be of all one breed, okay? They're all going to sound alike and they're all going to sound like yours. And so all the algorithms will cater to this. Then you're going to get what we call a tribal script. Everybody likes to be in a tribe, right? So they've isolated you, gave you the echo chamber, and then they're going to put you in a tribe. It's going to be us versus them. This is how it works when these guidelines are made. So there is rarely ever dissent going on in whoever makes any of the guidelines. All right? And then if somebody were to dissent, they're going to silence them. So they got a way to keep them down because it's possible that they could convince somebody otherwise that groupthink was not the right answer. And then they could use media. You guys know how that works. Where now the media, social media, the television, the radio, they're all promoting a certain thing. Like everybody needs a statin. So media plays a huge role in all of this, okay? But you have to understand that the fringes, so like this side versus this side, are not the majority. There's this whole area in between the fringes of pill A and pill B, or do nothing and do something. This whole area actually thinks more alike than they do in opposition. And so what we're being exposed to is all the fringes. There's no in between, okay? You are going to hear carnivore or plant-based. And these are the fringes. Not many people, even myself, falls in this middle part. And so we actually have more alike together. Plant-based people and animal-based people have more alike than they have on the fringes. But yet we're only exposed to the fringes in everything, our diet, our exercise, our jobs, healthcare. We're exposed to the fringes, and they do this by radicalizing us, and they get us to fight. They get all of you guys on YouTube to piss each other off and do the thing, and they're isolating you. They're dividing you. They're echo chambering you. They're tribaling you. They're silencing you. They're media propagating you. They're all doing it to keep you out of the middle. So you talk and you share things and you do things, but no, they're not. And they're going to isolate these divisions, and the divisions are going to be the guideline makers. Okay? And you can't really fight against them. It's difficult. Yes, Marnie, they are, again. Can you see, you can hear them. Yes, they are. They're being cute little things. Lucy says, any idea why a dog might get a kidney stone? The same way an adult gets a kidney stone. You got to find out what the stone is made of. Usually it's calcium oxalate. I would wonder what the people are feeding their dogs. If they're feeding them plant-based stuff, if they're feeding them vegetables, they're going to get oxalates, and they're going to draw the calcium out of their bones just like a human. And they're going to cause calcium oxalate stones. It's the most common cause of stones in humans. I do not know what the most common cause in dogs, but you could look that up too. But they could feed them a crappy kibble, and it's high in oxalates. It's high in poisons, basically. And dogs are getting kidney stones. And then they'll blame it on the water, or they'll blame it on you didn't walk them enough, or they didn't sleep enough, or do this enough, or you did over that. And no, it's likely from what they're eating. It's likely from what they're eating. They're getting stones from what they're eating. And like in humans, people who overindulge in eating raw plants are going to have high amounts of oxalates. And those oxalates over time are building up. They're drawing calcium out of the bones. The persons are getting osteopenic and osteoporotic, and they're getting calcium oxalate stones. Or gravel. They might be passing them all the time and not even know it. So, okay. Alex says dog food is cut with plants. Plants make everything that an animal doesn't, okay? So you are either eating plants or you're eating animals. There's no like in between. If you're not eating animals, you're eating things that come from a plant. If you're eating oatmeal, it's a plant. If you're eating a goldfish, it's a plant. An Oreo cookie, it's a plant. All of it was made from a plant. If you eat an animal, it is the animal, okay? So all of the people that are eating plants, that's got all the things that plants, and they're going to be fortified. You cannot take a plant, heat it, process it, maneuver it, chlorinate it. You can't do all those things and expect all the vitamins and minerals to be there. You couldn't put it on a shelf in the form of all these things. Foods, we call it food. It is not food. It is not food. It's factory consumption. You're consuming something made in a factory is what processing is. So it's taking something that was an original plant and processing it into something that does not look like the plant anymore. It had to be fortified in order to go on your shelf. In order to be fortified, some of that fortification is vitamins and minerals. One of those being non-heme iron. We can't absorb it. It builds up in our system and causes rusting. In simple terms, you're oxidizing inside your body. All of your cells are rusting. Just like rust on your car. Oh, scientific evidence. I love you guys. Yeah. Some foods, including meat, are processed. Well, sure they are. I mean, anytime that you put a meat through a grinder, that's processing. You've taken it from its original form and processed it. You've broken down bridges, basically. You've broken the bridges whenever you take a steak and make ground beef. I mean, that is a form of processing. But I'm talking ultra processing, ultra processed food. Okay. All right, you guys. YouTube. I always wonder why I continue to put myself onto YouTube, because of the rudeness over there and the fighting that goes on. But those 25 people who have liked and subscribed to my channel, I appreciate you so much. And for the 40 thumbs up, I appreciate that as well. The others, I can take it or leave it. I just ignore it over there. But you guys, if you are interested, I do consultations with you guys. If you want me to go over your labs, get a second pair of eyes to be a helper to you and your doctor, and give you some notes to take back to your doctor, and encourage what I would consider a shared decision-making type doctor-patient relationship, I'm here for you. And I charge $110 an hour. I don't know what other doctors are charging, but I'm assuming that they're charging a lot more than that. And maybe in time I will, but right now you could take advantage of that. I have spent 2 hours with people on the line, and I've also spent a half an hour with people on the line. But typically an hour's time to go over labs and to really explain what is going on, to give you enough time, take notes, and then you got enough information that you can take back to your doctor and discuss it with them, okay? That's what I love to do. That's what I feel that I'm able to help you with. Doing these question and answers helps lubricate your brain to get you to go look stuff up. You could ask me, like Lucy did, but she could also go look it up and let everybody know. I could look it up just as easily. I don't know everything. I'm learning just like you guys. I am on a journey. I was indoctrinated into a certain think tank in my past, and I've somewhat jumped out of that matrix and become an independent thinker. And that's what I encourage all of you guys to do, is independently think. I could be giving you wrong information, right? From what I've learned. But that's why now it's stimulated you to go look something up. But your doctor, you might have never even contemplated thinking that they could be wrong. You took them at their word. You didn't question the metformin. You didn't, oh, well, this is just something that happens. How many times, you older people listening, how many times has your doctor said, you've lived a good life? I mean, you're 80 years old, you've lived a good life. You're going to end up getting these things. Really? No, that's not right. Maybe the 117-year-old was doing everything opposite of what the doctor told her and eating the Greek yogurt. Okay? If you ask yourself the most common causes of death, the leading causes of death, what are they, you guys? Go look them up. Number 1, number 2, number 3, look them up. Look up the number 1 cause of death in United States population, or wherever you're at, Australia. Look it up. I dare you. Lori, what is my YouTube channel? IronLadyDoc. IronLadyDoc. So IronLadyDoc, it's on the same as Instagram. And it's also the same on Rumble. And it's the same on Twitter or X. The only place it is different is Facebook. On Facebook, it is Center Stage Primary Care. Center Stage Primary Care. That is the name of my clinic. Center Stage Primary Care on Facebook only. Otherwise, it's IronLadyDoc. Okay, so if there's no further questions, you can email me or message me if you want to sign up for a consult. I am here every Saturday at 9 a.m. Central Time and every Sunday at 10 a.m. Central. So Lord willing, I will be back tomorrow at 10 a.m. Central, and we can go over more of these questions, if you guys got them. Sometimes I bring other questions with me, because I think if other people are messaging in with questions that you guys likely have those exact same questions. Oh, Lori, try. Yes, Margaret Thatcher is Iron Lady. She is the Iron Lady, the original Iron Lady. Lori, go IronLadyDoc Malea Jensen, MaleaJensen, and it'll pull it up. See, I think because because of maybe the lower numbers of followers, that the searches aren't going to pull them up as readily. So if you put in IronLadyDoc Malea Jensen, it pulls it up right away. I've had patients do it in my office. So, okay. So if there are no further questions, we will call it quits today. We will be back, and yeah, we'll be back, Lord willing, tomorrow at 10 a.m. You guys have a wonderful day. See ya.